What does a bladder ultrasound detect? Imagine being able to see inside your body without any cuts or needles. That's what a bladder ultrasound does. It's a safe, painless test that uses sound waves to create real-time images of your bladder. This helps doctors understand how your bladder looks and functions, especially if you're experiencing urinary issues or are being checked for bladder health concerns. During the procedure, a technician applies a gel on your lower abdomen and moves a small device called a transducer over the area. The transducer sends high-frequency sound waves into your body, which bounce back to form images on a monitor. This process is quick and doesn't involve any radiation, making it suitable for repeated use. A bladder ultrasound can measure how much urine remains in your bladder after you urinate, helping to diagnose urinary retention. If your bladder doesn't empty properly, it can cause discomfort or infections. The test also looks at the size, shape, and thickness of your bladder wall, which can reveal issues like overactive bladder, urinary incontinence, or benign prostatic hyperplasia in men. One of the key uses of ultrasound is to detect abnormal growths or masses inside the bladder. It can visualize tumors or other lesions, showing their size and location. While ultrasound can distinguish between fluid-filled cysts and solid tumors, it cannot definitively tell if a tumor is cancerous. If a suspicious area is found, additional tests like a biopsy or cystoscopy are usually recommended for a more detailed diagnosis. Ultrasound is also helpful in identifying stones near the bladder outlet or ureterovesical junction that might block urine flow. It can show if there are obstructions or stones that could be causing pain or difficulty urinating. Furthermore, by comparing images taken before and after urination, doctors can assess how well your bladder empties and whether there are any issues with bladder function. It's important to note that while bladder ultrasound is very useful, it has some limitations. For example, in obese patients or those with a lot of intestinal gas, image quality might be reduced. Small tumors or lesions in certain parts of the urinary tract can sometimes be missed. In the context of bladder cancer, ultrasound plays a role in detecting tumors and monitoring their size or spread. However, it is not a standalone diagnostic tool. Usually, doctors will combine ultrasound findings with other tests like cystoscopy, computed tomography scans, or biopsies to get a complete picture. Overall, a bladder ultrasound is a valuable, non-invasive way to evaluate bladder health. It helps guide treatment decisions and monitor conditions related to bladder cancer and other urinary issues. If you're experiencing symptoms or have concerns about your bladder, talking to a healthcare professional is always the best step to determine if this test is right for you.